Retinoblastoma is a rare type of eye cancer that primarily affects young children, typically before the age of 5. It develops in the retina, the light-sensitive tissue at the back of the eye, and can occur in one or both eyes. Retinoblastoma arises from immature retinal cells called retinoblasts and is often detected through specific signs and symptoms. Overview prevalence. Retinoblastoma is the most common primary eye cancer in children, with an incidence of about 1 in 15,000 live births. Approximately 200 to 300 new cases are diagnosed each year in the United States. Types. Unilateral retinoblastoma affects one eye and accounts for about 70% of cases. Bilateral retinoblastoma affects both eyes, occurring in about 30% of cases. This type is often associated with a hereditary genetic mutation. Causes and risk factors. Retinoblastoma is caused by mutations in the RD1 gene, which normally helps regulate cell growth and division. Risk factors include genetic factors. Hereditary retinoblastoma involves inherited mutations of the RD1 gene, leading to a higher risk of developing retinoblastoma in both eyes. Sporadic retinoblastoma occurs without a family history, resulting from non-inherited mutations. Family history. The family history of retinoblastoma increases the likelihood of developing the disease, especially in cases of bilateral retinoblastoma. Symptoms. Symptoms of retinoblastoma can vary, but common signs include leukocoria, a white reflex in the pupil, often referred to as cat's eye, which is the most noticeable sign. Strabismus, misalignment of the eyes, crossed or wandering eyes. Red or inflamed eye, the affected eye may appear red or swollen. Vision problems, difficulty seeing or loss of vision in one eye. Pain, in advanced cases, the child may experience discomfort or pain in the affected eye. Diagnosis. Diagnosis of retinoblastoma typically involves comprehensive eye exam. An ophthalmologist will conduct a thorough examination of the eyes, often using dilating drops to assess the retina and optic nerve. Imaging tests. Ultrasound. High-frequency sound waves create images of the eye, helping to identify tumors. MRI or CT scans. These imaging tests provide detailed images of the eye and surrounding structures to determine the extent of the disease. Biopsy. Although not commonly performed in retinoblastoma due to the risk of spreading cancer cells, a biopsy may be done in certain cases to confirm diagnosis. Treatment. Treatment for retinoblastoma depends on various factors, including the size and location of the tumor, whether it affects one or both eyes, and whether cancer has spread. Treatment options may include observation. In very small, non-threatening tumors, careful monitoring may be sufficient. Laser therapy. Lasers can be used to destroy tumor cells or to help seal off blood vessels feeding the tumor. Cryotherapy. This involves freezing the tumor to kill cancer cells. Chemotherapy. Systemic chemotherapy is often used to shrink larger tumors, especially if the cancer has spread, or to treat bilateral retinoblastoma. Chemotherapy may be administered through intravitreal chemotherapy, directly injected into the eye. Intravenous chemotherapy, administered through the vein. Radiation therapy. External beam radiation or plaque brachytherapy may be used for tumors that are difficult to treat with other methods or in advanced cases. Enucleation. In cases where the tumor is large or the eye cannot be saved, the affected eye may need to be surgically removed. Prognosis. The prognosis for children with retinoblastoma has significantly improved with early detection and advances in treatment. Survival rate. The overall survival rate is about 95% for localized retinoblastoma. If detected early and treated appropriately, most children can be cured. Vision preservation. While treatment can be successful in eradicating cancer, preserving vision depends on the extent of the disease at diagnosis and the chosen treatment method. Some children may have partial or complete loss of vision in the affected eye. Conclusion: retinoblastoma is a serious but treatable form of eye cancer in children. Early detection and treatment are critical for the best outcomes. Parents should be vigilant for symptoms such as leukocyria and seek prompt medical attention if concerns arise. With appropriate care and follow-up, most children diagnosed with retinoblastoma can lead healthy lives. Regular follow-up is essential, especially for those with hereditary retinoblastoma, to monitor for any recurrence or development of secondary cancers.